Hello, and welcome to episode 14 of Homeopathy Simplified. In this episode, I'm going to talk about how to choose a homeopathic remedy, how to choose a reliable homeopathic remedy, and some key pointers for the process, as it's really not as simple as it sounds. It can be quite challenging. And let's get started with the introduction. So I'm Jonathan Damonte, a homeopath and Bowen therapist, and I first discovered homeopathy through my father, who in the 60s was one of the key teachers in homeopathy's resurgence in Europe at that time. And I was really fortunate to study homeopathy through his students, and I feel a very strong connection with him and his career. I also, after becoming a homeopath, I became a Bowen therapist, and I developed a practice focusing on chronic pain and disease. So now, after 28 years, I've come full circle, and I want to share my own knowledge. And as you probably know, I have created a course called Homeopathy Simplified, and it's really the course I wished I'd had in the beginning of my career. And it's a course created to make the complex simple and shine a path through a forest of ideas and concepts. This is my father, John Andre Damonte, and I probably look like him, but without the baldness. I should say that, rather than without, or with hair, half full, without the baldness. So we're going to talk about reliable, and in the dictionary, this is Webster's dictionary, it says suitable or fit to be relied on. And this is very appropriate in homeopathy because only remedies that fit the symptoms of a case would even touch it and create a response in the patient. And symptoms need to be reliable as well in order to find a reliable remedy. So we're going to need to talk about what are reliable symptoms as well. And one way in the beginning of using homeopathy, we use simple tools to look at which are the most common remedies for a particular condition, but the reliability of that is very low, and we get seldom positive results, mostly lucky, and mostly for ordinary conditions that are common in their symptoms to most people. One of the remedies, of course, that most people learn about in using homeopathy is arnica, because it's an injury remedy. And it is the most common injury remedy. If you have bruising and shock, even with bleeding, arnica is the one. I mean, you hear stories of people giving it to the bird who smashed into the window, and it'll revive the bird from the shock that they might be in. And that's the same for the person who has a bad fall. They go into shock, they have bruising and pain, and arnica fits those symptoms. So we can use charts like this famous one called Traumatic Man, and it gives a sort of overview of some of the conditions that affect different parts of our body and the remedies that might affect those symptoms. So if you have heat stroke, we might think of belladonna, glonoin, antimonium crudum, and I would add in natrum myrrh as well in that mix. Chilblains I won't talk about too much because that's so uncommon in our society. Blows to the head, spine, or coccyx, meaning injury to the nerve, we've got hypericum, which is interestingly is St. John's wort in herbal medicine. A black eye, because it might have ruptured blood vessels, ladum palustre. In addition to arnica for fractures, we've got ladum and symphytum. Symphytum is comfrey, which is known in botanical medicine as bone set. And in homeopathic terms, we don't give that until we're clear on how well the bone fracture is aligned. Nerve injury, I've mentioned a lot, hypericum, and it's a completely different use of the herb when we use it homeopathically. In the herbal context, we want to suppress the nervous system. And in homeopathy, we want to treat the overactive nervous system. That's why hypericum, if you bang your fingers in a door and you know that numbing nerve pain, hypericum will help so quickly it'll shock you. Wrists are such a common area of injury. We've got ruta graveolens, such a wonderful remedy. So I'm going through this because it's always nice to add a little bit of information. But the point is, these are common injuries, and these are common remedies that treat them because the symptoms are common as well. But when we get into individual injuries or individual acute situations or chronic diseases, we have to be much more precise with our prescription. We can't take a remedy for arthritis and give it to 100 arthritic patients. We'll probably get 10-20% success with that. That's not going to cut it for a homeopath. We need to be 70-80% correct in our prescriptions. So for wounds, we've got calendula, and this is very good topically. Many people use it as a cream, but as a mother tincture, also excellent. Bruises again, we've got ladum. In joint injuries and sprains, Rus toxicodendron, Ruta graveolens. Muscle strains, we've got arnica. And tendon injuries, Ruta. And I would add in Rus tox for that. And that's written here actually, old sprains of the tendons, especially in the ankle. Rus tox could be useful. And poison ivy reaction on the skin, Rus tox. In fact, Rus tox is in the family of poison ivy as a plant. Abuse of alcohol, drugs, smoking, food, nux vomica, an excellent remedy for overindulgence. This is very interesting. Puncture wounds, we've got ladum, and splinters that are hard to get out. We use silica. Burns, we've got excellent remedies for burns. We've got cantharis, so you take it internally, and you can use calendula and hypericum mother tincture externally. Urtica urens is stinging nettle, and sometimes a burn that's mild could benefit from that. Bee stings, we use Apis mellifica, which is the sting of the honeybee. And animal bites and insect bites, we've got ladum. I'd also put in Apis for that, and calendula topically. Excellent for healing those up. So just a quick overview of some very basic homeopathy. This should be a sort of opening and an opening of using homeopathy for these common conditions and having a first aid kit that could be very beneficial for a family. So I'm going to talk about musculoskeletal problems in this example that I'm going to give later. And the reason being is that I want to open the door to the multitude of different musculoskeletal conditions. And you can see a big list here. And you can't just look up rheumatoid arthritis and say, oh, Rus tox, bryonia, sulfur, phosphorus, natrum myrrh, all these remedies, they are all known to be good for rheumatoid arthritis. So how do you choose between them if you only have the disease diagnosis? However, we need to know the disease diagnosis because we need to follow the change in symptoms or non-change in symptoms after a remedy. So you need to know how a concussion recovers. You need to know what temporomandibular joint syndrome, what it would be like to give a remedy and how that would recover. Plantar fasciitis. What is the expectation of recovery for a condition like that? So that you can follow the action of the remedy and understand whether you're helping positively or not. And of course, when you talk about nerve conditions, you've got everything ranging from sciatica, neuropathy, numbness, let alone the brain disorders of cognitive decline. So we need to know the symptoms of a disease that are normal. And why do we need to know that? Not because we're necessarily going to prescribe on the disease name. For sure, the remedy we choose must treat the symptoms we are prescribing for. But we want to follow the action of the remedy, and that's called the pathogenesis. What is the course of a disease? We want to know the patient's description of the disease, the subjective, and we want to give objective, our observations of their state. Any scans, blood work, physicals, specialists' diagnoses would be helpful. And what's changed since the befallment, injury, trauma, illness? What are useful symptoms to a homeopath? So let's look at that. So what do we look for in order to guide our choosing for a reliable remedy? So we look for information that can yield a group of reliable remedies, and we differentiate which remedy is the best choice for the set of symptoms this person has. And, I use a very important book in homeopathy. It's called Bowen-Online's Therapeutic Pocketbook. And why? Because his system of laying out symptoms is built on kind of 4 pillars. And we want a reliable symptom that covers not only the location, but the cause of the condition. We want to know how the symptom feels, what the disease feels like. And we need that information. And concomitants are those symptoms that accompany another condition. And I'll give some examples of that. And very importantly to homeopaths are something called modalities. These are the symptoms or actions on symptoms that make it better or worse. So you can see on the bottom here, factors that make a symptom better or worse. So lying down when you have a headache, drinking cold water, warm water when you have a sore throat, putting hot pack or ice pack on a bruise. So those are all very important for a homeopath because we can use that information very easily to find a remedy that also carries those strongly, that trait of how you feel better or worse. A location is basically the cause or the area of the symptom. What it feels like, I mentioned, and then concomitants, those accompanying symptoms. So let's look at these more precisely. So a location or condition is the area and site, how the symptom extends or refers, and the direction in which it goes or stays in one spot. Sensation and causations, these are very simple. What is the pain? Is it better for touch? Does it go painful when you touch? Is it stitching, burning? Is there painlessness where you would expect some pain? Is there numbness? Is there a type of pain? Tearing, boring, stitching. Those are all types of pain. Aching could be described commonly. And modalities, interestingly, come into the way our senses are affected sometimes. And we have time, so sometimes the symptoms are worse at night. Sometimes they're worse in the morning when you're waking up, or they're only worse right after you get out of bed. The movement you make could affect the symptom. The weather, whether it's really cold or humid or hot, the opposite. The emotions, how those affect your symptoms, or how the symptoms affect your emotions. The temperature, maybe you only can sleep with this fever right by the window with the fan blowing on you. Maybe you can only lie on your back. Maybe you're sweating or sweating all over or in a certain part. Maybe your menstrual cycle affects that. So very useful information. And I've given enough sort of examples there. So a concomitant is very important as well because often a condition does have more than one aspect to it. And so these are symptoms that occur with or are coexisting with the chief complaint, whether in the same general area or even in a removed location or organ system. So for example, you have a throbbing headache and also diarrhea, or you have a right molar tooth pain with blurred vision. These are concomitant symptoms. And, these can be very common. Diarrhea with a flu and all the accompanying symptoms of a flu is super common. So we don't just give the remedy for flu. We want a flu with diarrhea and even the type of diarrhea. So oftentimes you don't consider other symptoms as being very important because they're not the greatest source of complaint to you. They're not the biggest aggravation. And yet it's important to know if there's anything else going on in your body that's unwell, or if it's at the same time as your chief problem. And that's important. And so here's a little case example. A man aged 71 came to see me 2 days after a fall. He rolled on his ankle, landed on his left elbow. He had a scan and diagnosed with a fracture at the ankle on the tibia, and then lots of ligament strain. But the biggest injury was the fractured radial head of his elbow. So right on the outside of your elbow, I don't know if you can see that, right there. This head of it shattered into 3 pieces. So he'd been put in a big cast, and it was a cast that was only half a cast. It doesn't enclose the arm entirely. And that was definitely helpful. He had, by then, the time of coming to see me, put it in a sling. He didn't really have a lot of pain. And so we went through his symptoms. And I just want to, we know that he's got a fracture. Then there is some swelling and there is some numbness in the area. And in homeopathy, we didn't have lots of information, just very basic things. We know the locations, ankle and elbow. It was worse for movement, both the ankle and the elbow. There was numbness, which is paresthesia. He was much better for cold applications, ice bag, right on the painful spot. Very much worse for pressure. In fact, the cast was giving him a lot of discomfort. He had a tremendous state of fear because he'd been told that he would likely need surgery. And he definitely didn't want to have surgery for the elbow. And then he also had a change in his low blood pressure. It was worse since the accident. So in homeopathy, we take those symptoms. You can see that we've got location for ankle, location for elbow, a modality, which is worse movement. We had a sensation of numbness, paresthesia. We have better for cold, also a modality. And then we have worse for touch and pressure, also a modality. A concomitant set of symptoms are fear and hypotension. And so putting all that together, I came to a group of remedies and I chose a remedy that actually is a common injury remedy. And that turned out to be Ledum palustre. I gave it in a very weak dose, 6C, and told him to take it twice a day, or if he had an exacerbation of pain. Anyway, the report was very promising. He really did do well with managing the pain using that remedy. So it came down to knowing more precisely what remedy. And it's not to say Ledum is the only remedy that would help. Maybe arnica could have been absolutely tremendous. Maybe ruta could have been tremendous for these injuries. Maybe symphytum could have been the right remedy. We choose based on the largest argument, the best argument calling for a remedy. So I'm not going to show how it lays out on paper, but there's often 4, 5, 6, 7 remedies that we would want to refer to in what's called materia medicus in order to know the best remedy choice. So I really hope you enjoyed that and understood a little bit more about how we can be more precise, more reliable, and more effective with homeopathy. And I do have a book on available to you for free. If you follow the link, you can get that. And also, if you just want to email me at the website, I'll get that to you. So thank you for listening. Thank you for following. And also press a like if you get the opportunity. Thanks a lot. Take care.